yeah, the most important thing is that relationship, right? We have to build rapport with our clients. So how do we do that? We have to be genuine, right? We have to be respectful and empathetic. It's really important. If you want to reach someone, if you want them to listen to you and hear you, they have to be able to be, they have to be able to relate to you, but they have to be able to trust you. And trust, the way to receive that trust or to gain that trust is with being genuine, not lying to them, respecting their opinions or whatever they say to you, right? And being empathetic. We can't always be sympathetic because we're not in their position, and it's not our place to say, well, I've been there. No, that's not your position. But realizing that they're going through something and they want to be heard, and we're there to guide them into a better space, right? The next point is the client should be cared for in a holistic manner. And what that means is we're not just concerned about their mind, right? In the space that they're occupying at the moment, that might be distorted or, not equipped for whatever, but we want to make sure that they're healthy physically. We want to know that they're, spiritually fed or whatever it is. So we need to be aware of the whole individual, spiritually, socially, emotionally, physically, right? All of that is important, and as well as the mental. So you're not, because the mental affects everything else. If they're not mentally stable, they might not know to take a shower, or they might not know to eat their food, or they might not know to go to work. And we need to be aware that every part of them is important, right? Then our next point here, I gotta move this again. Okay, there we go. So the nurse considers the client's cultural beliefs, and this is important, right? And that's why a part of it, when we think about their therapeutic, we have to see what patient we're looking at, right? It's not a cookie cutter situation where one thing applies to everybody. No, everyone is different, and they're different because of the background they're coming from, the experiences that they have, and that is shaped by their culture, right? There's a certain attitude and a certain way a person perceives life. It stems from how they were raised and what culture and environment they're coming from, right? One of the things that we study in nursing is, for example, eye contact, right? A person might not make eye contact, and you might think, oh, they're not listening, or they're afraid, but it's not. That's just how they culturally are. Or maybe someone is loud and verbose and assertive, and you're like, wow, they're aggressive, and it's not about the aggression. It's just how culturally they might be. See, and the problem there sometimes is also realizing what the culture is and realizing what stereotypes are, right? We don't want to fall into stereotypes, but we want to be consciously aware that everyone is coming from a different background and they respond to different things different ways, right? And taking that into consideration as we relate to them, so that we're not experiencing whatever it is in just one view, in this like tunnel vision kind of way, right? The next thing is appropriate limits and boundaries. This is also important in psychology because you have a person who might not know what their boundaries are, and you have to be the one to set that for them, to show them and guide them so that they know what is appropriate and what's not appropriate. And you yourself, as the nurse, you need to know that limit yourself, because maybe your patient might not, and you need to be the person to say, okay, there's so much I can do, but I can't go but this far, because then since they don't know their limits, if you don't know your limits, it can be a very bad situation, right? So knowing your limits and boundaries of what you're able to do and what you're supposed to allow them to do. Being honest and open, we talked about that, right? Not beguiling them and making them think things are going to be okay when you're not sure. You're only human, right? And so you don't know the course and what's happening. What you know is your clinical information. You know what the books say, and you see what's being presented to you. So you should be using the knowledge that you have appropriately, and not trying to have the person have maybe a higher expectation for something that you're not sure yourself, right? So being honest and open, communication, letting them know, maybe not, exposing your fears. Maybe you are afraid, right? But being professional enough so that you can have an open communication and telling them how you think this is going to pan out in a professional way, using the techniques that we're going to talk about as we go through this course, or as you study more of psychology and nursing, because we're not going to be able to see everything. It's not always, clear cut, how how to do certain things, but using your peers and those who are been there and done that, that will help guide you in what kind of words to use and what's the better communication. And sometimes you might go wrong, and I'm just going to be honest, right? You might say something and it might tick them off, and you have to be able to reel back and try to reassess the situation and what can I say and what can I do and how can I have this person open up, right? You don't want to ask questions where it's like, no, yes. And we'll talk about this, right? You want to try to see how can I get this person to talk to me, to open it, so I can see what is causing them to have these issues and how can I help? Because you can't help if you don't know what you're helping and what the problem is, right? Then the continues and says the nursing uses therapeutic communication techniques, right? And we're going to talk about what those techniques are. And that's one of the things was like the open-ended, right? You don't want to you tell them, ask questions where they're going to tell you no and yes, right? And you also want to show them with, with your gestures and with your words, not just verbally, but your expression, like, nodding or being present, like eye contact and having a certain distance so that they can see that I'm present, I'm listening. And that is part of communication as well. It's not only just verbal. And number 7 says the nurse respects the client's confidentiality. Now, this is, an iffy subject because a lot of people, sometimes they're like, oh, do I keep this to myself? Don't I keep this to myself? Well, HIPAA will tell you what to do, right? Because there's certain things that you are not supposed to divulge. It's on the contract or whatever you signed. You're supposed to keep everything to yourself. The only time that you're allowed to speak anything that happened between your patient and yourself is if the person is going to harm themselves or harm another person. And now you might have to get, police involved. And even then you have to be careful what you divulge, right? So making sure that anything your patient tells you stays with you, right? And let's say they're talking about their family members or someone that, even if it's a family, something where the other person is there, whatever that patient told you stays between you and that patient. So being very careful what you say and how you say it with other people. And even in reference to your coworkers, right? When you're discussing your patient, if that coworker is not going to be part of that dynamic of helping your patient, right? Like let's say we're in milieu therapy where you have the social worker as well, and you have other people who are going to be aiding in helping bring this person from whatever circumstances, situation they're in to society outside, but they're in that milieu. Well, yes, you can approach a social worker or physical or whoever it is and talk to them. But otherwise, no, you keep it to yourself and your patient. Okay, now let's move on. It talks about phases of the therapeutic nursing client relationships. Let's talk about that, right? So there's steps and phases to this, and that's great to know that you don't have to just, you're not just thrown to the wolves and you're like, what do I do with my patient, right? Well, the first thing you do is you want to do research, right? You want to do a pre-interactive before you meet the patient, read their dossier, right? I feel like, I don't know if you guys, obviously have gone to the doctors, right? But recently I went to the doctors. I had a person come and they talked to me, right? They said, what are you feeling? What is this? And what is that? And they were writing, and I was glad that they were writing all this information down. I'm like, oh, this is a good place, right? And so then, but they were just like, the, what is it called? The medical assistant. So the doctor was to come afterwards. Now, when the doctor came, now, you would think I spent 5 minutes telling them my history, family, and everything that happened and why I'm here. Now, you would think when the doctor comes in, she would be stemming from something that was in the papers or the iPad. But no, they started all over. I'm like, wait a second, so why did we have this information? My point is, if you're taking this information, you have to learn, look at the reports. What is wrong with your patient? Who is your patient? What's their culture? What's their identity? What is, you want to develop an understanding of the patient you're going to see before you see them, right? Because maybe this is not a person that you can work with. Maybe their history might cause you to have some kind of biases. As we see here, explore any preconceived ideas, stereotypes, biases, and values. Listen, you're human and you can't help your feels and emotions sometimes. As a psychologist or, a nurse or a psychiatric nurse, you might be able to come, to terms with it and have it on the wraps. But you are human and you need to be aware of that and know that there are certain people that you might come in contact with that you might not be able to help as much as you want to. And it's because of maybe something in their history that is just eating at your heart and you can't stand them, and you face that. and let that go and pass them on to someone else. Because what it is you need to be able to speak from a heart that's without bias, without stereotype. You need to give them, the genuine part of you, not the guarded and angry and whatever, right? So the only way to do that is to find out first who this person is. So make sure you read on them first. Then the next part is, now the patient is here. You're orienting them, okay? They need to know, okay, what are they expecting? Who are you as a person? And as you talk to them, you're relating that, your expression, the way that you carry yourself. They're going to see through your verbal, your words and your nonverbal words, whether they can accept you and whether they trust you and whether they can build something with you, right? And then this is also where you establish your boundaries. You tell them, this is how this course, the course of this help, this therapy, this program, whatever, this is how it's going to go, right? You also define the goals. They'll state their problems and their issues. You already are aware of them, but you'll tell them, this is what we plan for you. This is what we're going to do together. These are what the different etaps, the different levels we're going to see. And these are the goals, right? We're going to define them. But the most important thing, and this is going to be on the exam question, and as you hear from me, you'll always hear me say, this is an exam question. And this is because I've seen many questions and I've seen some that have repeated a lot. And so this here, the termination, is something that they love to have you indicate, that you are aware that the termination process of any encounter with a medical professional is always dictated or stated in the very beginning. You need to let them know this relationship is not forever. We are going to find a time where we're going to end after our goals are met, and we're going to, we no longer will be together, right? And they need to know that. And tell them about the separation and the relationship discussion. And that way, it's not a surprise. You're not going to just throw something on them like, tomorrow's our end date, or next week is like, what, hoo-ha, but I thought we were here for like months, so you need to let them know from the very beginning. And this part here is also, in admission, let's say in the hospital, right? You need to let them know that, okay, these are the plans that we have, and at some point you're going to be discharged, right? That same idea that you saw in med-surg, this is the same idea in psych as well. This termination is very important, and you tell them about it in the beginning. And then there's a working phase. This is when you actually sit down and you're going through all the information that you have, you're interacting, you're exploring, you're focusing on their issues, you're helping them see what they need, and you're doing it in whatever method you've decided, or whatever practice you're in, because they're going to be different places, but at, wherever the setting is that you're working, what that setting calls for is how you're going to work, right? So you're going to explore, and you're going to explore, focusing, evaluating the client's concerns and problems, encourage independence, right? We never want to like feed, like do everything. And we want to, not pry, but help them realize for themselves, what can I do? And what do I have? And we'll talk about the different, mechanisms and coping mechanisms. We want them to see it for themselves, right? To explore those things. And that is part of the work that we put in. And then there's a termination phase, right? There's a time where it's come to an end. And this is a really hard time. As much as you talked about it in the beginning, it's still going to be very difficult for some patients, especially when they build a good rapport with you and they really like you. I had a coworker tell me recently that he was on vacation, and before he came to the job, he was with this there was this other doctor who was working, and then he replaced him. Anyway, he's on vacation, and his patients come to the office where the setting is, and they're like, where's NP such and such? They call him doc. Where's Dr. such and such? And they're like, he's not here today. I'm like, okay, we'll wait for when he comes back. Now, for a person like that, who they'll rather wait to have you come back, even if it's a whole week. Now they've built like this rapport, and they've grown fond, or like they feel like this is a person that can, get to my issues, right? It's going to hurt. And you have to prepare them and allow them to express themselves, right? Encourage them to express their feelings about termination, but expose that, help them come to terms with it, but being firm, right? And then the thing is too, if they haven't reached their goals, because you have a set time, and it might not be that you've resolved everything, right? Because we're a complex people, and things add up in life, and things change, and a certain course that you thought it was going to take, well, it turned, and you might not reach the goals. Well, you're reassessing, right? You reevaluate, and then you decide, okay, maybe you need more time, or maybe you need some other help, or maybe you need a follow-up care. And this is a time where you're going to tell them, okay, you might have to come back, or you might have to go to someone else, and this is the time. Or maybe it's a community resource. Maybe we've used all our resources here, and maybe you need outpatient care. So this is the time where you do it, right? For more information on how to register for classes and get help from our tutoring center, visit www.gabnicnursingtutor.com. That is www.gabnicnursingtutor.com. To view our free or paid classes, sign up on www.thinkific.com. That's www.thinkific.com, and register for the pre-recorded classes of your choice after searching for the Gab-Nic Tutoring Center uploads. We offer in-person tutoring and Zoom calls. You can also find us on YouTube for more free classes and tips on how to do better in nursing. We are also on Facebook, where we upload articles, tips, and tricks on how you can make your journey to becoming a nurse smooth and near effortless. Did I mention Instagram? Basically, we are everywhere. So check us out or call 917-602-9927 and we will tell you just how to join. See you soon.